Thank you, Dr. Saxena, for this good overview and of the implementation of the global strategy. The adoption of the global strategy really put alcohol back on the agenda in all policies. And even though we in the European region had adopted policy documents back from 1992, it made a huge difference also for the European region. Thank you.
Bu bölümün ikinci konuşmacısı, değerli arkadaşımın da patronu olarak çalışma arkadaşı, Avrupa Bölge Ofisi'nin bulaşıcı olmayan hastalıklar sorumlusu Doktor Gauden Galea. Buyursunlar efendim.
Thank you. Thank you very much to both chairs, and in an unusual situation, I'm here presenting with one of the chairpersons. Equal credit to Lars for this presentation. Only the good parts are his. Our challenge is to try and say how we are working together within the non-communicable disease and alcohol arenas, tightly linked because we're in the same division, and symbolically, and even more than symbolically, very really tied together by the fact that the action plan for alcohol and the action plan for non-communicable diseases were both adopted in Baku in September of 2011, just 1 week before the UN the UN General Assembly high-level meeting led to the political declaration on the prevention and control of non-communicable disease. In symbol, in timing, in organization, and in real action, the two are two sides of the same coin. We also work within and close collaboration with our colleagues in headquarters, and there has been a resurgence of priority given to non-communicable diseases in the last 2 years. The targets and indicators just mentioned by Shekhar are one example of this close-knit. With these targets, we are also developing within the Health 2020, which is a European health policy. We're also developing targets and indicators that bind together the global, the regional, as well as the thematic concerns. And within Health 2020, we have a couple of significant concerns, two strategic objectives that I would like to highlight a little because they haven't been mentioned. When one is the fifth or sixth speaker in a talk like this, it's difficult to find things that haven't been said. But the two strategic objectives of Health 2020 are addressing and the reduction of inequities and proper governance for health. Both of them are key themes for the control of harmful use of alcohol and indeed for the reduction of alcohol consumption on average in the region. We need to look at the differences between countries. We need to look within countries for the impact that alcohol has on different socioeconomic groups. And we need to move forward involving the community, involving civil society, giving a voice, as well as bringing in all the sectors in society, except, of course, those that have a conflict of interest. We are doing all that within the European NCD Action Plan alongside the Alcohol Action Plan. This slide alone summarizes that action plan and would take the rest of my time. I would just highlight the points which we are using to try and link together the work, the thematic work on the individual risk factors with the overall non-communicable disease action, with the importance being given to comprehensive integrated planning, to improvements and integration of the health information system. We realize, for example, that our current health information systems are very compartmentalized. You can get excellent information on alcohol policy, excellent information on nutrition policy, the same on tobacco policy, but bringing them together is proving to be quite a challenge, and that is one which we are addressing. We would like to see better work being done in coordinating our work on fiscal and price policies, as well as on marketing even in just creating networks that cross the boundaries and are able to learn from each other. The European Status Report is one of the most recent products of this monitoring activity. A new one is on its way in line with the Global Status Report on Alcohol and Health, and so before the end of the year, one would hope to see both. Within that, Jürgen Rehm has already identified the trends within Europe. I bring his slides onto one slide to show the great differences that there are. It's difficult for me to point, but in the upper left-hand corner are the Nordic countries, which are extremely low, even though they are much higher than Turkey. So if I had to show Turkey on those slides, one would need basically to have a graph that hugs the horizontal axis. But if you look at the Nordic countries, very, very low, but with some alarming trends of an increase, fall in most of the rest of Western Europe, apart from the eastern red countries, if you see the graphs, or remember the graphs that Jürgen Rehm showed us earlier on. It's not just the increase at a population level, it is some of the numbers that come out of ESPAD, the survey of 13 to 15-year-old children and adolescents, and you can see in a couple of selected slides, I've taken the girls' slides just to make it a bit more dramatic. 50% of the girls used alcohol in the past 30 days in the European Union, and 15% on average got drunk in the last month. The number and the level of these numbers is much higher in boys. The problem is apparently declining, but in the young people, it is very much there. They're very much the target of marketing, and we don't know that the declines we are seeing can be sustained if young people continue to smoke. We have two problems illustrated by this slide. One is the problem that we need to nudge, push, or motivate the whole population to reduce their alcohol consumption on average. And this slide is showing the distribution of the amount of alcohol consumed by different groups of the population. In the bar graph on the right-hand side, you can see that about 75% of the alcohol consumed is consumed by people who drink it at a hazardous or harmful level. This speaks very well to the 10% decline target that we would like to see on a global level. But at the same time, this drinking is not restricted to people who drink it to get drunk, but there is a large amount of drinking that happens in the rest of the population, and it is there that a large amount of the harm accumulates, and we must therefore adopt a double approach: one, to reduce overall alcohol consumption, and secondly, to address the binge drinkers and the high-level episodic drinkers. Numbers you have seen, Jürgen Rehm's were sufficiently compelling, but just adding these two, 75,000 male deaths and 17,000 female deaths are attributable to alcohol in the European Union. If you go broader, the study, this is not our study, but it is the Global Burden of Disease as published in the Lancet late last year. You can see our region, this time not the European Union, but the larger European region. Alcohol use was fourth as the risk factor by attributable burden of disease. As you go to different fractions of the region, as you come to Central Europe, it becomes second. As you go to Eastern Europe, and in this case it means the CIS countries, the Commonwealth of Independent States, it comes up to be the top cause of mortality and morbidity. We have a long history, ironically, a couple of ironies. We're in the country with the lowest consumption of alcohol and still discussing the issue on a global level. We're the region that has the highest level of consumption, and yet we have the oldest alcohol control program among the WHO regions. This is just a review for some of the people here. This is a trip down memory lane, many battles fought in the past to develop the alcohol action plans from 1992, from 2000, the framework for alcohol policy, and of course, more recently, the evidence reviews and the alcohol strategy, the alcohol action plan adopted, as I said, in Baku in 2011. All the data is available in the mirror site of the global site that Shekhar presented. So there is a European information system on alcohol and health, which over 2013, we are seeking to also integrate in a timeline fashion with other policy databases, NOPA, which is about nutrition and physical activity, and our tobacco control database. From these databases, my 10 minutes are up. I'm into the last 2 minutes of extra time. I take that responsibility away from the chairs. We're seeing that there are some areas where there's quite a lot of improvement in the last 5 years. In policy areas, for example, in public awareness raising, in drinking and driving policies, where only 2 countries are above the 0.5 limit. But then other areas highlighted by Marianne this morning, regulation of marketing, impact on affordability, these policies are not making enough progress in the region. And I highlight here, I wish I had more time to discuss it, the multiple opportunities that exist for us to be able to discuss any one of these areas, in this case on pricing policies, because there's a lot that can be learned in terms of the evidence, in terms of current practice across Europe, and about the social impact of policy interventions in terms of price in tobacco, alcohol, and food. Clearly, we need it in alcohol. This is just one slide of a series that shows the large variation of the price of alcohol, of standard amounts of alcohol in different forms across the region. And you will find that it varies by almost 40-fold between the cheapest and the most expensive in the region. Clearly, this is one of the drivers of the blue to red colors that Jürgen Rehm was showing us early on. From tobacco and food, we are accumulating a large amount of evidence, which would take me yet another lecture to discuss on what are the impacts of pricing policies. We need to engage and move forward in this area, among others. We have recently co-produced the Alcohol in the European Union report that condenses much of this evidence, and the next speaker, our close colleague, Michael Hubel, will be linking to that from the side of the European Commission. We're connected to the global process, and not just in the target setting, but also we are connected to the global process and the global action plan in identifying best buys and tools for interventions, alcohol interventions being among the most cost-effective interventions that can be adopted worldwide, and no less in the European region. I leave you with, so that if you get the slides eventually, you can get all the information that I've just hinted on at this stage. I thank you for your attention. I conclude with one of the points that Shekhar made. We have done well on collecting and are beginning to do well on integrating and feeding back the evidence. We have done well in monitoring policy. We have established a mandate at global and regional level. We have countries that are leading and some very positive trends, but we are left with one big gap, the great difference in policies that exist in some countries, and the challenge that we have to now find ways, with your suggestion, of developing a collaboration between WHO in some countries, the European Commission, as well as with your national governments, to identify specific packages of interventions that can lead us to go forward, not just now in broad alcohol policy, but in specific areas, affordability, regulation of marketing, and consumer labeling, protection of workers, the types of issues that were raised by Marianne earlier. Thank you very much.